Welcome back to the Doc Talk podcast. I'm Dr. Sheila Wijayasinghe.
And I'm Dr. Shazma Mathani. Today we're talking about travel health, but first a quick word from our sponsor.
So we want to take a moment to thank Figs, our season sponsor. And honestly, this is an easy one for us because Figs are what we actually wear to work. Their scrubs are comfortable and flattering and genuinely cute. We get compliments on them all the time from patients and colleagues, and they're so incredibly practical as well. The pockets actually fit what you need: phones, notes, pens, everything. And in colder clinics and hospital hallways, the layers really do help keep you warm. Their compression socks are another staple, supportive enough for long shifts, but still cute. Same with their hair accessories: headbands, claw clips, and scrunchies that actually stay in place on busy days.
And then their work bags are awesome. They're thoughtfully designed with multiple compartments to hold everything from my stethoscope and gear, and then of course the power-up snacks and change of clothes if I need. And if you don't work in healthcare, the Figs loungewear is incredible. It's thick, soft, high quality. I actually got my husband a set and he lives in it. If you work in healthcare or you're shopping for someone who does, Figs just makes sense. Go to wearfigs.com and use code FIGSDocTalk, that's FIGSDOCTALK, to get 20% off your first order. That's wearfigs.com, code FIGSDocTalk.
Okay, Shaz, so let's get into it. Something that we love talking about because we love doing it: travel.
Yeah, and with spring break coming up and also all the summer planning happening right now, we know many of our listeners might be traveling as well. So we wanted to arm you with what you need to know both from an ER doctor perspective and a family doctor perspective, because nothing derails a trip faster than preventable illness.
Or an emergency in a country where you don't speak the language and know the system. So we're here to support you.
So today we're covering a few different things around travel, including vaccines and malaria prevention, what to watch for while you're away, what to pack in a travel health kit, drinking water safety, insurance, and what to do if something goes wrong.
So let's start, Chaz, with what do you do before you go on your trip? And this is something I work with my patients often around when they tell me, I'm going to go to Mexico, I'm going back to visit friends and family in India. Wherever you're going, the important thing is to think about things ahead of time so you can plan ahead. Ideally, you should think about travel health about 6 to 8 weeks before you actually leave on that trip, because that gives you enough time for the vaccines to work that you may need. And for those series that you might need multiple doses, it gives you enough time and enough lead time, really. If you're pregnant, immunocompromised, if you're traveling with young kids, or you're managing a chronic health condition, earlier preparation also helps you get ready for a trip, which can be a little bit stressful when you're traveling with any of those conditions.
Yeah, and so that's absolutely correct. Step one, though, is making sure you're checking reliable evidence-based sources. So in Canada, that means checking out the Public Health Agency of Canada. They have a health travel website where you can search by country and see what vaccinations you need. The other thing you could look at is the World Health Organization, or even more directly is booking an appointment at a certified travel health clinic where they can do a consult with you and let you know what you need for the place you're traveling to.
Yeah, so this is especially important. So I always suggest to my patients, even though I'm a family doctor, I do some travel medicine in my clinic. Not all provincial health plans will cover travel medicine support under your provincial health plan. So travel clinics are often private care, but they are really helpful, especially if you're going somewhere tropical or higher risk or higher altitude for extended stays, because they really know what's happening currently in the places that you may be traveling to and to help you get ready in a really safe way.
And that's a really important point about what's happening currently, right? Because there are often different travel advisories for different countries and things will change. And so they will review your destination, your length of stay, the type of travel, like whether you're just staying in cities or going into rural areas, the type of accommodation that you're going to be having, the activities, and then your medical history, and then make some recommendations based on that.
Absolutely. And so what we can do for you in family medicine, though, and this is where I think this is an important thing to talk to about with your family doctor or nurse practitioner, if you have one, are the common vaccines, that making sure that they're up to date. So the routine things are things like tetanus, measles, especially important right now, polio, influenza, COVID, and pertussis or whooping cough.
Yeah, and so making sure those routine vaccinations are up to date is definitely important. And measles, as you mentioned, Sheila, is a big one right now because we are continuing to see global outbreaks, and even travel to different parts of Canada can actually put you at higher risk. In addition to Europe and the US, because you do have risk if you're not vaccinated. Make sure to check out our previous episode on measles because we do get into the details on measles vaccination and what's important as well.
Yeah, the Public Health Agency of Canada just came out with a recommendation to check your measles status. So if you're not sure if you're up to date, you can check your immunity or what we do in our practice is we actually just boost people if they're not sure in ways because it's a very safe vaccine, and we'll set you up for safe travel, especially with the measles outbreaks happening around the world. The other piece is to also think about what we talked about briefly with the travel clinic is the destination-specific vaccines. So these are specific illnesses that you will see in other places that you may not see in Canada, so we don't have immunity built up against them. So think about things like hepatitis A, hepatitis B, typhoid, yellow fever, Japanese encephalitis, and rabies in specific settings.
And yellow fever in particular is unique. I've actually had to have this vaccine before. This is probably like 10 or 12 years ago, where my husband and I went to Tanzania and spent some time there. And so it was a requirement to go there. And the thing with yellow fever is that you actually require proof of vaccination for entry into the country. So this one's an important one. It's not an optional one. The rabies one that you mentioned is often overlooked as well. And so this one, I mean, it's not a particularly commonly recommended one. There's really only very specific circumstances that it is recommended in, but you need to know if it is. And so if you are traveling with kids to rural areas or places with stray animals, pre-exposure vaccination can actually or may actually be recommended for you. And so it's really, really important to be very specific when you're doing your travel consultation about exactly where you're going, especially to name the rural areas that you're traveling to.
Yeah, I remember getting the rabies vaccine when I was a resident because I had coverage for all my medications at that time. And so I'm like, give me every vaccine. And rabies was one of those. And I'm actually quite glad because I traveled to Cambodia and places where there were a lot of stray dogs. And there was a risk of potentially exposure to rabies. So always one to think about, but not always discussed. The other one I think is important to really address, Shaz, are the bug-borne illnesses, so mosquito-borne illnesses like dengue fever and malaria. So we often focus on malaria because we have a medication that you can take to prevent malaria if you get bitten, but dengue is really common as well and is often not discussed enough. Why it's important is that it is present right now in the Caribbean, Central and South America. But what makes it different is that they are daytime biting mosquitoes rather than the nighttime biting mosquitoes that malaria is. And there's no real prevention for it. So mosquito prevention protocols are really important if you're traveling to dengue affected areas, which a travel clinic or one of the sites that you mentioned, Shaz, can let you know.
And if you are traveling to a malaria endemic region, which I've been to quite a few in my life, this is a really another important thing to consider because malaria is really not a mild illness. It can actually become life-threatening quite quickly. It's often like top in my differential when I see a fever in returning travelers from a malaria endemic area. Like the first thing I do when I see that triage note of like, recently returned from overseas travel, they're having a fever, I look on the map and look to see if it is a malaria endemic area because some of the sickest patients I've seen that are coming with an infectious disease that ends up being malaria, they can actually deteriorate really quickly. So it's not just a mild mosquito-borne illness. It is something to take really seriously.
No, I've had patients get very sick returning with malaria and having to be hospitalized. So it's a really important thing to consider. So if you are traveling somewhere, there's no vaccine for malaria at this time, but there is something called prophylaxis. So there's medications that you can take to prevent malaria if you are bitten while traveling.
Yeah, and those medications really depend on the region that you're going to because there's different kind of subtypes of malaria, like the organism that causes malaria, there are different subtypes of it. And so different medications act against different subtypes, and that really depends on where in the world you're traveling to. And so there are a few different medication options, and each of them kind of are important to discuss with your travel health consultant to see what's going to be the right fit for you.
Right, because each of them has their own pros and cons. I've taken all the different types of malaria medications, Chaz, and I know that they have different side effects personally because I was affected by many of those side effects. So, some of them also, and they all have different protocols in terms of how you take it. Some you start a couple of days before you travel, some are a week before you travel, some are every day while you're away, some are once a week. So that's also important to consider because they have different types. So depending on where you go on one trip, you might have had a different medication than another trip.
Yeah, and this is exactly why that travel guidance is so important. And then, Sheila, you did mention the mosquito precautions. That's another important one, even if you're on medication, because of course nothing is 100%, right? The medication is going to help prevent getting malaria, but you are still potentially at risk. And so making sure that when you're out and about, you're wearing long sleeves and long pants, you're using an insect repellent with DEET or iCardin, and having mosquito nets over your bed when you're sleeping at night.
This is so important. It makes such a big difference, right, Chess? So, the other thing I want to mention, I often talk to my patients in my practice who are traveling home to see friends and family. So often these are situations I can think of my own personal life when my family went back to Sri Lanka. We never got vaccinated when we traveled home. We never took any extra medications, and malaria is in Sri Lanka. And it was one of those things that this is a group of folks who travel back home to see family and friends and sort of think, I have immunity because I lived here when I was younger, but you actually may not have immunity. So think about your parents or you or yourself. If you're born somewhere else, it's still important to consider some of these precautions because you may not actually have that immunity anymore and you're at risk of coming home with one of these illnesses. And we want to protect you as much as possible.
Yeah, and that immunity only lasts for at the longest up to a year. And so that immunity, and you have to consistently be living there for that period of time to continue to maintain that immunity. So that's a really good point to mention. Okay, so let's shift gears and let's dig into travel insurance because this is really where I certainly see it emerge. People underestimate risk related to things that can happen when you're traveling. And so if you're traveling outside of Canada, you absolutely need travel medical insurance. This one is a non-negotiable for me.
Yeah, and this is why, I see again in my own practice as well, when patients come home and they didn't realize what it would cost to have a hospital admission. So, for example, if you're traveling to the US, we think it's really close, the border's closed, not a big deal, but it can cost tens of thousands of dollars. Sometimes an ICU stay can cost over hundreds of thousands of dollars. And this is so important to consider and why insurance can help you out.
And that's just the medical costs, right? So on top of that is also the medical evacuation back to Canada. And that can often cost hundreds of thousands of dollars. I have seen this happen in the emergency department where people are traveling. They're completely healthy. They have no medical problems, but accidents can happen, right? Whether it's a fall, or, a car accident, something can happen. They get sick because of a disease that they catch while they're there and they end up being in the hospital. These things happen. I've seen them happen. And then having to have the repatriation back to Canada can also really be quite expensive. And if you have good medical travel insurance, everything is covered.
Yeah. And tell me, Shaz, because you probably see this more than I do, even within Canada, even though provincial healthcare is portable between provinces, coverage isn't always seamless. So tell us a little bit about that.
Yeah. And so we have to remember that the Canada Health Act covers doctors and hospitals, right? And so things that are kind of outside of those two things are generally not covered. And so that includes things like ambulance transport or air evacuation, any prescription drugs. If we're talking about travel interruption as well, those are not things that are going to be covered, even if you're in Canada as well.
So that's where travel insurance can also be helpful. So if you're thinking of getting travel insurance, think about a plan that has emergency medical care, hospitalization costs would be covered, medical evacuation would be covered, and trip interruption would be covered as well.
And one kind of really important footnote is to make sure you disclose all of your medical conditions accurately because pre-existing conditions can exclude things and can actually then, even if you end up getting sick and it's not related to your pre-existing medical condition, there could be a tie between that and that could actually invalidate your insurance. So every little thing, it needs to be mentioned on your medical questionnaire.
And this is not meant to scare people. Our goal is that you go and travel without worrying. So this is why we're having this conversation. I talk to my patients, especially early pregnancy patients, Shaz, when they're ready to travel. I'm like, this is a pre-existing condition now that you're pregnant. So we have to consider these things, disclose that when you're getting insurance to make sure that you are covered in case you need that support. So let's talk a little bit about one of my favorite topics. I know you post a lot about this, Shaz, in terms of when you travel, what's in your travel health kit. And this really depends on where you're going, your own health history. But generally, you want to have, your regular medications in their original containers so you don't get them mixed up. You want copies of your prescriptions so you know exactly what you're taking, and an extra supply of your medications in case of delays. And if you take certain medications, one of the things that's really important, certain medications don't cross borders as easily. So things that are controlled substances, things that are stimulants like ADHD medications or narcotics, if you have chronic pain history, it's important to have a formal letter from your own prescribing doctor saying that you are prescribed these medications. So I write those for my patients all the time. I say you have to take this with you because if you're crossing borders and they ever stop you, you have that documentation to help you through.
Yeah. And then in addition to those really important basics, I actually have a little kit that I don't leave home without when I'm traveling. And so it always is just packed as my travel medical kit. And then I replace things or replenish things as I need. And so it includes things like oral rehydration salts. So whether they're tablets or packets, gastrointestinal illnesses are really, really common when traveling. And so just being able to have that, something where you can add water to it is really important. Anti-fever and anti-pain medication. So acetaminophen and ibuprofen, both adult versions and kid versions. anti-diarrheal medication, anti-nauseant medication, again, because those gastrointestinal illnesses are so common, antihistamines for allergic reactions, basic wound care supplies, so just some gauze, Band-Aids. I carry skin glue with me as well, which you can get.
Same. All the time.
Hand sanitizer. I actually just put the hand sanitizer in everyone's little like day packs. Insect repellent with DEET, especially if you're traveling to a malaria endemic area, and then sunscreen for the body and for the lips, because the lip sunscreen is often one that's forgotten too.
I feel like my friends are always really excited to travel with us as a family because I have a
'Cause you
very
have the medical
extensive
kit.
health kit every time I travel anywhere, and it like takes up a good chunk. And they actually are so sweet because they're like, "We'll take the kids' swimsuits and everything. You just bring the meds. We've got you covered on that side." And I love it because it's really like it just helps me feel safer to know that we have these in case of emergency, because these are the things that you need. And in a moment that you're urgently vulnerable and needing something, it's helpful. It's really helpful to have it handy.
It's funny that you say that because the same thing happens with me. I go on a hiking, like a backcountry hiking trip with my girlfriends every summer. And in our group chat, I was always like, "Hey, well, Shaz has the medical stuff covered. Like, well, someone else will bring some, like, a box of wine or whatever, but Shaz has got the medical kit."
Yeah. Yeah, we're a good friend to travel with, right?
Mhm.
If you're traveling somewhere remote, also consider a couple of extra supplies, non-medical, but like a thermometer I always take with me too,
Mhm.
especially if you're going somewhere more remote, and if you're with kids. A small flashlight is helpful in the middle of the night if you're looking and try to dose things. You want to make sure that's okay. A list of emergency numbers as well. And also, if you're traveling with kids, make sure that you have the dosing, like the syringes that are for dosing kids' doses out, because that's important and you don't want to leave home without that.
And then really big important point to remember, always carry your medications in your
Mhm.
carry-on, not your checked luggage. I'm sure we've all been through the nightmares of our checked luggage being lost. So this is something that I always carry in my carry-on.
Okay, Shaz, so let's get to diarrhea and food and water safety, because this is a big one that affects many people when they travel, and it can really put a damper on your trip. So traveler's diarrhea is super common, and the classic advice still applies here. So drink bottled water or treated water only. Avoid ice in high-risk areas. So you want sort of distilled water making ice, and they should tell you that if you're at a resort or something like that as well, just to make sure it's safe. Avoid raw or undercooked meat. Avoid unpasteurized dairy products when you're overseas, and peel fruits yourself, because then you know that it hasn't been through uncleansed water, like non-distilled water as well.
And then a kind of a point on street food. So street food is not automatically
So delicious.
unsafe. Exactly. Like I love going to a new country and trying out their street food because that is like the most authentic and delicious food that you can often get. And so it really just depends on the hygiene and food handling. And so in general, I would say busy stalls with higher turnover are generally safer than food that's been sitting out. So just something to keep in mind. I don't think you have to completely avoid it, but you just need to be cautious and think about those things.
Yeah, and you want to also be careful, because when we're speaking about diarrheal illnesses, or if you have a fever with that, you're losing a lot of fluid potentially. And so dehydration is a real danger here of these illnesses, especially in kids and older adults. And so that's where you mentioned it earlier, Shaz, oral rehydration matters. So with the salts or with fluids regularly, really important to be able to treat, because it's not necessarily the diarrhea itself that we're worried about. It's the actual dehydration that can be quite dangerous.
That's exactly, and that kind of leads really well into this next part about watching for the symptoms that while you're there. And really, this is all the same stuff that we've mentioned on previous episodes to watch for, like you would if you're here at home. You're going to watch for these things when you're traveling as well. So things like a prolonged fever, severe diarrhea, persistent vomiting where you're worried that you can't keep fluids down. If there's any confusion, chest pain, shortness of breath, blood in the stool, a severe headache, these are all reasons to seek medical attention at home and when you're away.
Another important piece to remember is if you develop a fever, and Shaz, you mentioned this earlier, if you go to a malaria endemic area, and you develop a fever after you come home, it's an emergency until proven otherwise. So even if you took the medication that's meant to prevent it, please do seek care. And also while you're away, be mindful of things like sun exposure, altitude illness, heat illness, and road safety as well.
Yeah, the road safety piece is really important. I mean, my family and I were in Vietnam a couple of years ago, and like that is actually a really stressful environment to like even just cross the road in. But road traffic accidents are actually one of the biggest risks for travelers globally. And so wearing seatbelts, being careful when you're crossing streets, avoiding motorcycles and scooters. If you are going to use them yourself, make sure you have a helmet. And then, of course, having caution with like alcohol in unfamiliar environments, because again, you're away from home and these are actually a very common source of injury when traveling. Okay, so important things to consider before you leave. We've talked about kind of all the things to consider before you travel, kind of while you're there, and then what about before you leave? And so I always make sure to have an idea of exactly where the nearest hospital is to where I'm staying, what the local emergency number is there, how to contact or the location of the closest embassy in the country, like the Canadian embassy that you're in, and then how your insurance actually works.
So I love that you're sharing all this, Chaz, because I have to say, I don't do any of these things before I travel. So I'm taking this for myself. We have an upcoming trip coming up, and it's really good. It's actually helpful just to kind of have it organized a little bit in your brain. But I've traveled so much over the years, and I've never known where the nearest hospital is, but I appreciate that you do. You're my emergency medicine friend.
I'm like, where I play through a lot of scenarios in my head. And so I'm like, I need to know where the hospital is and like how I'm going to get there, depending on where I am in my travel
where's the nearest
journey.
outlet mall? That's like my, but yes.
I mean, there's a shopping list and a medical list for sure.
Fair. Okay. And one final note, if you are feeling unwell after you return, often we can downplay that and say it's because my sleep is off, I'm jet lagged. But if you have a fever, persistent diarrhea, a rash, or unexplained fatigue, talk to your healthcare provider after that and let them know that you've traveled, because knowing that detail changes our entire workup. Like you said, Shaz, you're going to look for malaria if you've come back from a malaria endemic country. I'm going to look for dengue if you've come from somewhere else like that. That is important information that really helps us do better for you.
And I mean, like all this being said, Sheila and I are people that travel a lot, even, while still being prepared. And so travel should be joyful. Preparation doesn't really take the fun out of it. It actually, in my opinion, protects the fun, because then when you're there, you're well prepared, you're healthy, and you're not going to let something preventable ruin your vacation.
Yeah, a little planning really dramatically can reduce the risk. So making sure that you are, checking your vaccine status, reviewing your malaria risk, getting your insurance, and packing intentionally make a world of difference.
And I mean, if about the packing intentionally piece, if you want to know how you can pack for 3 weeks in carry-on only, I have some travel rules on that.
You have that too.
Love packing on carry-on only. And then, of course, if something feels wrong while traveling, trust your instincts and seek care early.
So thank you to everyone for tuning in today to the Doc Talk podcast. A reminder that the Doc Talk is for general information purposes only. This podcast is not intended to replace medical advice from your own doctor. While we are doctors, we are not your doctor. Always speak to your own healthcare provider for questions related to your personal health needs.
And make sure to follow us on social media at the Doc Talk Pod. And of course, be sure to like, subscribe, and review us wherever you get your podcasts.